What's up everyone? In this video, Daisy, one of our EMT students, is going to be doing an NR EMT style proctored medical assessment. So follow along with her with your sheets and then stick around to the end where you'll see the feedback she gets from me as the proctor. Daisy, ready?
I'm ready.
Okay, cool. So you are medic 1. You're being dispatched to a single family residence for a 30-year-old male who family reports is minimally responsive.
Minimally responsive. Okay. So upon arriving on scene, first thing I'm going to do is put my PPE on, BSI.
Okay. It's done.
And I'm going to check to make sure the scene is safe.
Scene is safe.
All right. Okay, the first thing I need to address is the nature of illness. So for this, I'm going to go with the minimally responsive. We're going to have to look into that further.
Okay.
Is it just the one patient today?
Just one.
Okay. And I am going to request ALS assistance for now.
Okay, they're en route.
Okay, and I'm going to keep C-spine considered. For now, I'm not going to act upon it until I know more.
Okay. Considered.
All right. So, general impression, what am I seeing as I walk on scene?
You walk into the living room, you find your patient just like you see here.
Just sitting in a chair?
Sitting in a chair.
Okay. And level of consciousness, is he following me with his eyes as I walk in?
As you see.
Okay. Okay, head's nodding a little bit. So he's not following me with his eyes. I'm going to see if he's responsive to verbal stimulation. Can you hear me, sir?
Yeah.
Okay, so he is responsive to verbal stimulation. So I'm going to put that down, just responsive to verbal. I'm going to ask him a few questions just to see if he's oriented. Sir, how old are you?
30.
Okay, do you know what year it is?
2021.
Okay, and if I give you 3 pennies and I take one, how many pennies would you have?
2.
Okay, so based on these questions, I'm going to say he is oriented. So I'm going to put it down as A&O times 4. And I am going to assess that chief complaint and life threats, make sure there's no apparent life threats at this moment. Okay. So make sure there's no bleeding or anything going on right now. Do I see anything?
No bleeding noted.
Okay, so just that chief complaint is that minimally responsive. I'm going to start by assessing his airway, making sure it's open and patent. Okay. Is there anything wrong with this airway at this moment?
Airway appears open and clear.
Okay. And then I'm going to assess his breathing. Can I get the rate, rhythm, and quality for that?
He's breathing shallowly at 10 times a minute.
Okay.
Which is regular.
And then since he is breathing slow, he's at 10 breaths per minute, I am going to give him oxygen via non-rebreather. Okay. I'm going to set it at 15 liters per minute. Next, I'm going to check his circulation. So I'm going to check his rate, rhythm of quality for his pulse. Do you have that for me?
Yeah, pulse rate is 90, strong and irregular.
Okay. And how's the skin looking? Is it looking pink and warm all around?
A little pale.
Okay.
Otherwise normal.
Okay, and then he's not bleeding anywhere?
No bleeding noted. Okay.
Next, I'm going to take just a full set of vitals for him. So you did just say that his pulse was 90.
Okay.
So can I get his blood pressure?
Blood pressure is 132/86.
Okay, and then the pulse was 90. And then I'll take his respiration rate again in case it's increased.
Yeah, respiratory rate's still at 10.
Okay, and then can I get his SpO2 percentage?
SpO2 is at 90% on that non-rebreather.
Okay, and then can I get a blood glucose on him as well?
Blood glucose is 106.
Okay, so I'm going to get a sample history on him. So is there any other signs or symptoms I have not addressed yet?
All as you found so far.
Okay, and then, sir, do you have any allergies?
Sudafed.
Sudafed? Okay. And are you on any medications right now?
No, I don't take anything.
Okay. Do you have any important medical history?
My family keeps putting me in that like facility or whatever, but no, outside of that.
Okay. When was the last time you ate?
I don't remember.
You don't remember? Okay. What were you doing when, I guess I could ask the family. Does his family know what he was doing when they found him out of this state?
No, they're not sure. They just
Walked
found him
in?
like this, yeah.
Okay.
Walked in on him.
Okay, and are you experiencing any kind of pain or anything right now, sir?
No pain.
Okay. Well, right now, I'm going to say that this resident is kind of just like out of it. I'm going to ask him a few questions just to see if I can assess his neuro a little bit further.
Okay.
So I'm going to go through the AEIOU TIPS scale.
Okay.
I will also go through the Glasgow Coma scale just in case as well.
Okay.
Okay, so just as a precautionary measure, just to test where you're at this moment, I'm going to go through this. I'm going to ask you a few questions and just watch you for a minute, make sure you're still here with us oriented, okay? All right. Your eyes are still blinking. Can you follow my finger for me? Okay. And then I'm going to ask you just a couple more questions just in case, okay?
Mm-hmm.
Okay. Do you know who our president is this year?
No.
No, you don't? Okay. Can you tell me what 3 plus 5 is?
8.
Okay. And once again, can you just tell me your age one more time?
30.
Okay. And then I'm just going to pinch your shoulder really quick, okay, just to see how you react to it.
No.
Okay. Put that down on the floor. Okay. So I'm just going to write down what he scored on this GCS scale really quick. Give me just a moment. Okay. And I'm going to ask you a few more questions. Have you had any alcohol in the last few hours?
No.
No? Okay. And then you don't have any history of epilepsy or seizures or anything?
No.
Okay. You don't have any history of like excessive sweating, losing a lot of fluids? Have you had any water in the last few hours?
No.
Okay. And then you haven't had any kind of drug use or anything recently?
Well, what do you call a drug? Because I've been using that one stuff, but it just makes me a little sleepy.
That one stuff? Do you remember the name of this drug?
No, it was a little blue pill, though.
A little blue pill. Okay. How long ago did you take that?
I don't know.
Okay. Do you know if that's a prescription drug for you?
No.
Okay. Have you had any recent infections or anything?
No.
Okay. And you said you don't have any history of stroke or anything like that?
Nope.
Okay. Asking the family at this moment, would you guys know anything about a small pill that he would have taken?
They tell you he has a history of opiate abuse.
Opiate
They're
abuse?
not sure what he's using recently or if he has been using recently, but he does have a history.
Okay. So at this moment, for my field impression, I'm going to say that he is experiencing a low-level overdose at the moment. I'm going to keep him as a high priority patient with us, and we're going to transport him. I'm going to take another set of vitals on him. Can I get a full set for me? We'll start with blood pressure.
We're going to say no change.
No change? Okay, and then for pulse?
No change in any of the vital signs.
Okay, they're all the same?
Yep.
Okay, so his oxygen's holding good. Glucose, honestly, I think our best option would be to give him a dose of Narcan for us. So I'm going to give him 2 milligrams of Narcan intranasally. And then we'll reassess in 5 minutes. Let's say 5 minutes has passed. Has his vitals changed at all?
Yes.
Okay.
Now that he has been given some Narcan, he's much more active and alert.
Okay.
His SpO2 is now up to 98%.
Okay.
His respiratory rate is at 20.
Okay.
And then vital signs other than that are consistent with what they were before.
Okay, perfect. I am going to radio in to the nearby hospital. I'm going to say it's St. Luke's.
Okay.
So I'm going to say St. Luke's. This is Medic 1.
Okay. Go ahead, Medic 1.
All right. I have a 34-year-old male. Field impression was that he was having an overdose on a narcotic drug. I have given him a 2 milligram dose of Narcan on the way. His vitals are blood pressure is 132/86, pulse 90, respiration rate 20, SpO2 98% on a non-rebreather mask. We're about 10 minutes out. Is there any questions?
No questions. We'll see you in 10 minutes.
Okay, thank you.
Anything else?
Not that I can think of.
No. All right.
Shaking.
No, you did a good job.
Okay.
You passed the scenario. So, a couple things I noticed initially, and I think this is probably just nerves because we're on camera.
Yeah.
You asked him what year it was, and he told you 2021.
Oh.
Then you said he was alert and oriented times 4.
Okay.
So I'm guessing that was just nerves being in front of the camera that you didn't catch that he said the wrong number.
Yeah.
There. So that would have made him alert and oriented times 3.
Okay.
Right? Because he missed that question.
Yeah.
The non-rebreather right up front was good. You did the ABC as well. You got all the vital signs there. You came down, you did a good job with the secondary. He was giving you some hints, the sample history, he's giving you some hints about, what's a drug, all that kind of stuff, and you kind of were keying in that maybe there's something going on there based off his presentation, I could tell. Your secondary I thought was pretty good. You talked about AEIU tips. You asked a lot of questions there, seizure histories, those kind of things. You got the family involved, which is good if you have somebody that's willing to give you some information there. But let's talk a little bit about GCS score there. So what number did you end up getting?
I got 12. I think I did that wrong, though. It was a little hard for me because then I was thinking I should have done that earlier, kind of when I did the A&O instead of as like a history type thing.
Yeah. We're not quite as concerned about when you get it done. We just need to find a GCS score.
Yeah. I've never.
Talking about the number that you got.
Okay.
So coming down to eyes.
Okay.
You were able to, he tracked you, right? He's looking at you when you walked up, so that's going to be a 4.
Yeah.
We have the sheet here that you were kind of marking down. Coming down to verbal response, you asked a couple questions. Again, he told you he didn't know who the president was, I think is what he said.
Yeah.
Right? So that's going to knock a number off there. So he's no longer oriented.
Yeah.
So you have confused. But I see here that you marked down he withdraws to pain.
Yeah, he pulled that shoulder away. Isn't that what withdrawal would be?
He did, but we're going to start at the top and work our way down. So the first thing is going to be follows commands. And if I ask my patient, can you touch your nose? And he does that, he's going to hit a 6 on that score.
Okay, so I should have started with like, can you do something for me?
Yeah.
Okay.
Yeah. Just ask a simple command of him. And you already did. You asked him to follow your finger.
I would have counted for both.
Yeah, he was a little sluggish and wasn't able to kind of keep up, but he was still trying to follow your commands.
Okay.
So his brain was active enough to hear what you were telling him and to act upon those things. Is what we're looking for. So your GCS score was off for that reason.
Yeah.
But just a little time kind of learning GCS and practicing there. I think you'll be good. Coming down, your field impression was some sort of opiate overdose. Like you said, you called it low level, which I'd agree with. He was a little bit lethargic, but he was not unconscious. Yeah. But you still treated with Narcan, which I think was appropriate. He was breathing 10 times a minute. Yeah. And so he needed some sort of treatment there. 2 milligrams of Narcan intranasally is perfect. And then, did you get the response you expected post Narcan?
Yeah, his respiration went up to normal, SpO2 went up, everything else seemed to stay, where it should be.
Yeah, exactly. You kind of fixed the issue that you had. So,
okay.
I thought you did really well. Good job.
Thanks.
One other thing with opiate overdoses, what can we look at that would give us a lot of information towards an opiate?
Like the scene? No. Oh, their eyes, like the pupillary, like how big they're dilated.
Pupil response.
Yeah, thanks for catching that. I wrote it down. I forgot to mention it.
Yeah, just double check the eyes.
Okay.
Yeah, they say eyes are the window to the brain, right?
Yeah.
And that's if we suspect a drug overdose, especially an unknown drug. He told you he took a little blue pill.
Yeah,
then I was like, what it is.
Pill.
Yeah, and so if we have an opiate or kind of a downers, right?
Yeah.
You might have those pinpoint pupils versus if it's like an upper, you might have those
really big
pupils.
Yeah.
Right? So it's a good thing to look for. Thank you for catching that.
Yeah.
Easy thing to check, and this guy would definitely have some pinpoint pupils based on the rest of his presentation.
Okay, good to know.
Good job.
Thank
Good job,
you.
Daisy.
Thank
All right, everyone, that was Daisy running an overdose scenario. Hopefully you learned something from it and were able to follow along with your National Registry sheet at home. Make sure that you subscribe to the channel. Check out our other videos. We have a lot of other videos of different assessments and lectures and all sorts of things. Leave a comment if there's something else you would want to see, and we'll see you next time.